Here is your question.
Okay.
Okay, so if you have read and understood, considering it critical care scenario, kindly please tell me, how would you manage this patient?
Okay, I manage the patient according to care of critically ill surgical patient.
Right.
We'll start by checking the airway and then the breathing and give the patient oxygen and put the pulse oximeter and then go for the circulation. I will check the vital signs, the capillary fill time and the pulse and also the blood pressure. And then I will put 2 large bore cannula and put the urine catheter. And the patient already have high creat, high urea, and high also high electoral disturbance. I will start by giving the patient bolus of IV fluid, and I will check the response, and I will go for treat the electoral disturbance. Patients have hyperkalemia.
Yes.
I will start by heart stabilization. By give the patient calcium gluconate 10%, 10 ml in 10 minutes slowly with the ECG monitoring to stabilize the heart membrane. And then you also give the patient insulin with the dextrose 5%, 10 ml, 10 units.
Thank you. Can you please tell me what might be the cause of acute renal failure?
Okay, it could be due to pre-renal cause, renal cause, post-renal cause. It could be due to vomiting, diarrhea, like dehydration, loss of fluid, and as a pre-renal cause, or patient use diuretic, or renal cause due to renal failure or glomerulonephritis. Or toxicity of any drugs, and post-renal cause due to obstruction, renal stone in the ureter, or obstructed by BPH or tumors.
Okay, so since patient has presented with hyperkalemia, so what is the most serious complication that you worry about?
I'm worried about cardiac arrhythmia.
Very good. Okay, so can you tell me what are the complications of acute kidney ischemia if it's untreated?
Okay, it will affect
acute kidney injury. I'm sorry.
Okay, it affects all the body as the central nervous system. Patient will be agitating and confused, and
what also is maybe this situation called?
Encephalopathy. Just 1 second. Uremic encephalopathy.
Very
maybe.
Good. Okay.
Yeah,
yes.
and also I will patient will have like shortness of breath and gasping due to pulmonary edema, and also patient will have arrhythmia or maybe also atrial fibrillation due to hyperkalemia, and also this pulmonary edema due to hyponatremia, and also maybe patient suffering from edema in all the body, and
you have probably observed that uremic patients, they often present with anemia. What might be the cause?
Okay, the anemia of chronic disease.
Yes.
Due to patients have decrease in the GFR and the renal function will be not stimulate erythropoietin secretion from the kidney that will lead to affect the production of RBCs from the bone marrow and lead to anemia. Also, uremia will be directly toxic to the bone marrow, lead to bone marrow suppression and also anemia.
Right. You have corrected the patient, managed the patient, and you've inserted the catheter. Subsequently, all of a sudden, you observe that patient's urine output is high. Why? What's causing increased urine output?
Okay, this diuretic phase of renal failure due to the correcting of the cause. The kidney will at least glomerulus it's working, but renal tubule not compensated yet, not working. That lead to the renal tubules cannot reabsorb the water from distal convoluted tubule. That lead to diuretic phase of the renal failure, it's early phase.
Okay. Right. Can you please tell me, if you can tell me what the knowledge of the cardiac effects of potassium could be beneficial for surgical candidates, surgical aspirants?
I couldn't remember couldn't understand. Please, can you repeat the question?
Hyperkalemia and the effects of hyperkalemia on the heart. Why do you think it's important for the aspiring surgical candidates?
Okay, due to risk of arrhythmia, that will lead to affect the anesthesia, and also this arrhythmia will affect the cardiac output and may lead to complication in the heart, like my MI and.
Okay, can you name the functions of the kidney, functions of the potassium in the body?
Okay, calcium is important in the muscles of the heart and of the skeletal muscles for the muscle contraction, and also important in the heart also for conductive system of the heart, and also potassium important in the cell membrane resting for changing with with sodium. Also potassium important in maintaining of the electrolyte of the body and acid-base balance, and important in the gut also for gut motility, I think.
Okay, can you please tell me what might happen if patient presents with hypokalemia?
Hypokalemia, also patient will have risk of arrhythmia and hypokalemia also lead to cramping of the muscles and decrease the heart rate. And
can you name few conditions?
Okay, hypokalemia.
Diarrhea, one.
Okay, diarrhea and hypotension, muscles cramp, maybe lead to I couldn't remember actually.
You are okay. Last question. Can you tell me what should be the normal, if tell me the normal levels of the potassium?
Okay, it's like from 4.4 to 5.5, right?
Okay. No.
Yeah, 4. Just 4.
Okay.
4 to 4.5 maybe.
Right. Right. All right. One last question. I did say that was the last, but now the really last question. Just suppose you're managing this patient and patient's hyperkalemia does not get corrected, and in order to save the heart, you decide to go for the dialysis. Can you tell me what are the ethical considerations you'll keep in your mind when making this decision?
Okay, I first will counseling the patient and the family and take consent from the patient.
You can't, because see, patient is
Ah.
dementia and
Yeah,
is
okay.
unconscious. So what more can you do?
I will go for best interest of the patient by take consent type 4 by 2 consultants,
Good.
and then admit the patient to intensive care unit for dialysis
Yes, and
and inform the family.
you'll inform the family, but in that unit there is a special nurse and
Yeah, nurse for dialysis and also central line insertion or what?
yes, that all you have done. So you'll give the preference to the patient. You'll consider the better quality of life. You'll the contextual features like health resources, family support, etc. And the one important first one is the medical indication. After that, so these 4 things you'll keep in your mind. Good. Thank you.
Thank you.